We set up a goal for them for the first 4 weeks, and then we reassess that. So if we see that, okay, somebody's just not really making any headway, so we'll meet back with them and find out what's going on. Are they, have they been sick? Do they have something going on at home that maybe is interfering? Or did we maybe set our mark a little too high and we have to slow up a bit, and then we'll change those goals. Then we do that again for the second 4 weeks, and we reassess all of those tools again. It's a fairly labor-intensive process, but the patients come out feeling wonderful, and, or I should say, much better, most of them. And they're taught the skills to know how to contact us when they're starting to feel like they're getting in trouble, so that we prevent them actually getting back in the hospital. So I think that's a very good skill set for them to have. At the end, once a year, there's actually a national lung games, where it's like a mini Olympics that is for people that are in pulmonary rehab. And we usually have taken a silver medal at this, sometimes even a gold. So you'd be surprised. We have people that sing Christmas carols. They have their oxygen on, and we have a choir that we have. We've had 82-year-old women playing Wii tennis, which was the goal of that particular individual. She used to play tennis with her friends and had to give it up. We got her back playing tennis. So we started her with this Wii program and worked it up. The way that we go about exercising them, we have a target heart rate, and most of these people have cardiac comorbidity. So they have heart failure, or they have had an MI or maybe bypass surgery. It's not that they've just suffered an acute event, but we monitor them for dysrhythmias. We monitor their oxygen during it. That's the biggest thing that usually will be the problem. And so we add oxygen if needed, and we even use non-invasive ventilation techniques, so like positive pressure, so that we put a mask on them so that we can actually push them to their max to get them in better shape. Because the better shape their legs get, particularly their quads, the better they can utilize oxygen and expend less energy doing their activities of daily living. So it's a process of monitoring everything. Some people have actually had dysrhythmias, and we've had to send them down to the emergency room. You know, that's why our folks are skilled in advanced life support. We have all the safety monitoring that goes on, and AED, crash cart, etc., depending on where your location is. So we're prepared for those kind of events. We do have a home protocol that we put together for them. So we give them TheraBands, you know, you see a lot of the green bands, and we give them these exercises to go home with. But we have a maintenance program. So the maintenance program, once you finish your 8 weeks, you can go into that. That's strictly all exercise. So they can come in any day of the week, and they can come in and exercise for that half hour. And that kind of stimulates them so that they see their friends. So it's a good social support. And we sometimes, if we have someone who we think is going to be maybe a little more frail, we'll make phone calls back to them and say, I think maybe you need to come on back into our maintenance program.